Like
Take
that.
that, please.
Nice.
And 3.
I've had a lot of experience. I think this is a 39th sync clap.
39.
I know we do 2 per episode, so it's 39, 38 plus times 2 plus 1.
78.
77,
77, yeah.
Yeah, quick maths. Assalamu alaikum and welcome to today's episode of the Islam 20C Unscripted podcast. If you're joining us for the first time or if you haven't subscribed yet, then do remember to subscribe. Click the bell notification down below so you get notified for any upcoming episodes. And also just a reminder that we're on pretty much all of the podcast platforms, wherever you get your podcasts. So do remember to subscribe. Now, a lot of us, as you can see by our producer Mahmoud's shopping spree here, we're quite worried about this coronavirus outbreak in China. A lot of, especially in Muslim social media, people are talking about this. And we had the pleasure now of, alhamdulillah, having a consultant in infection, Dr. Imran Qureshi. Assalamu alaikum.
Wa alaikum salam.
Thanks for joining us.
My pleasure.
So
I just contaminated you.
thank you very much.
Sorry.
So you're a consultant in infections, and that used to be called microbiologist.
Still
I think.
are, but we use the term interchangeably.
Okay, so just tell me like it is. Yeah, don't sugarcoat it.
All right.
How long do we have left?
You have very little.
Because some people are really scared.
Yeah, I mean, I think I'm sort of, you know, I'm glad that this opportunity arose to sort of starting to dispel some myths, and then there's the panic that's ensued from the notification of the Wuhan coronavirus has been interesting. Certainly across social media, text messages. I was saying I received numerous text messages from people telling me to wash my hands and to fear for my life and stuff like that, and which I disregard summarily, on a regular basis. And then send some rather irate text messages back saying, please don't spread fake news, that type of thing.
So fake news is also spread via
fake news.
Infectious.
Yes, absolutely.
Yeah.
So I think there's because
I've seen like videos of people like stockpiling stuff in their bunkers and fighting over things in supermarkets. Obviously that's been in China, so it seems like a very serious thing there. But
it's not to say that it's not serious. I mean, I'm not going to detract from the whole seriousness of people are dying. I mean, that is the reality. I think the death toll is kind of something like 100 now in China, something like that. I think I was reading recently, and it's not necessarily contained in China. There's been cases in Thailand and other surrounding countries. There's been some cases in, I think 1 or 2 cases in Germany.
I saw that
one in the United
news
States
today as well.
Absolutely. So it's not that the virus is a joke, or that it's not important. But I think the level of panic about what the potential transmission to us in the UK, or even if you think about the population of China and the number of people who've died and the number of people sick, there is a proportion. I mean, as we know, the media loves to embellish everything and make it sound more.
But then again,
fantastic.
are you taught to say that?
No, I have no reason to be taught to say anything.
I mean, obviously, if it was something panic worthy, the line would still be "Don't panic," right? Because panic only makes things worse.
Absolutely, you're right.
So I can't tell if you're trying to,
Yeah, this isn't Dr. Staqiyya, or this isn't a form of that. I mean, you're right. I mean, obviously, we tell people not to panic, but the reality of the situation is that we have tested, I think, at least 13 people in the UK, and all of them been negative. And because the problem is that, I mean, I think I'm trying to avoid getting too much into the science of it, but coronavirus is a very regular virus, but there are different strains of the coronavirus which can produce a very severe pneumonia. So the Wuhan strain is one of them. I mean, this may alarm even more people, but there is a syndrome called the Middle East Respiratory Syndrome, which is also caused by coronavirus, which can potentially be fatal. So if you visit sort of Saudi, Dubai, Jordan, various countries, you are at risk of acquiring that coronavirus yet because it's sort of not in the media and people are not.
So
sort of
MERS.
MERS.
Yeah.
So it's another type of coronavirus. So, but there's many different coronaviruses that people get on a regular basis, and actually they'll just get like a flu-like illness and they'll be fine. And even people who may contract the Wuhan strain of coronavirus, it is possible that, in fact, probable that they may not end up having a fatality at all. They may be fine in the end. They may have quite a serious illness, but they may be fine in the end. And there are lots of factors actually when it comes to viruses that dictate how a person will respond to them. So, such as the amount of exposure, what the immune system of the person is like. Are their lungs normal, for instance, if they're like chronic smokers or they suffer from lung conditions like bronchiectasis or something like that, or they're more susceptible to the infection. It's harder for their lung and their immune system to fight off that infection. So there are lots of factors that we don't know about the people who have died.
But the scary thing is that in today's day and age, especially if you live in a city, you can be pretty certain that there's going to be a flight from anywhere in the world, pretty much.
Absolutely.
During that day or a few days or a week period.
Yeah.
So something that is contained in one place. Yeah. It just takes one person.
Absolutely.
To.
And actually, what's important is that not that everybody does this on a regular basis, but those of us in the field, we sort of read the information that comes out of Public Health England, or the official body who basically inform us of what's going on, how they're dealing with, and what the response is. So at the moment, all direct flights to the UK from Wuhan have been suspended.
Yeah.
And any flights which are coming from China, there is actually quite a rigorous process of reporting and trying to find out well in advance if people are unwell. Even if people land from one of those locations, they're not unwell at that point. They're given information about the signs and symptoms to look out for. So basically, if you arrive back and within 14 days you're developing symptoms, who to go and seek attention from, how to present. There's lots of information around
so
that.
With this particular strand of coronavirus, you're saying the mortality rate is really low.
I think the problem is that I don't know how many people are infected.
Yeah.
So
I read somewhere it could be as much as 100,000.
Yeah, that's what I mean.
Yeah.
So what my suspicion is that there's probably larger numbers, but because because the media is highlighting the cases that have died, people are losing all sense of proportion. I mean, it's the same thing with seeing anything in medicine which is biased. So, for instance, as somebody who deals with infections all the time, I see all the infections of pregnancy and the horrible things that they can lead to. So I remember when my wife was expecting with our children, I was terrified until 20 weeks because the bias of my brain, which just sees all the problems, felt like something horrible was going to happen, even though, if you think about it logically, the overwhelming majority of pregnancies are completely normal. But as soon as you put that,
it's false vividness, isn't it?
Yeah, it's almost like an information bias, isn't it? So you're perceiving something which isn't the case because of the exposure, and you're creating a response on the basis.
Part of it is the need for the news to show something.
Yeah, absolutely.
Like newsrooms up and down the country, people are like editors are probably like, why aren't you publishing something about this? We need live updates, we need rolling credit banners and 24-hour kind of wall-to-wall coverage.
Absolutely, and it is the job of the media, as we've seen from the recent general election, to embellish everything that they do. I make no bones about sort of attacking the media for that at all. And
Mahmoud told me before this episode, he said Imran Qureshi is coming, and I want you to watch this Netflix series, right, about some pandemic, and it scared the out of me.
Yeah, if you watch movies if you watch movies like Outbreak and stuff like that, they're pretty scary.
But I mean, this is billed as a some kind of documentary kind of series, so I thought it's not going to have the same Hollywood kind of embellishment and those like zombies or anything like that. But
it felt like it did.
I was scared. I mean, I was watching it walking to the station. Luckily, watching on my phone as I was coming this morning and didn't kind of get run over, alhamdulillah, or walking to any lampposts. But scary stuff,
you see,
man.
At the same time, I'm not advocating that people should get on the next flight to China and say I'm here for a holiday. I'm not suggesting that.
Our solidarity or anything?
No, I think probably not. But I think that the point is that again, let's put it in proportion. The number of people who have been infected with the virus are probably in the hundreds of thousands, possibly.
Yeah.
Okay.
But what this thing was about, though, sorry to cut you off.
Yes.
is that they were looking at, historically,
Yeah.
right? Human beings have had large kind of plagues and flu kind of pandemics and epidemics. What's the difference, by the way? Pandemic and epidemic.
It's the scale
worldwide.
of the outbreak.
So some kind of huge outbreak, causing millions and millions of deaths. So one was the most recent one they said was 1918, some influenza outbreak that killed more than 50 to 100 million people. They said in the program it was more than World War II and World War One combined.
Right.
So, and that was with a fraction of the number of people traveling between countries as we have today. There was no commercial airlines then. Right?
I think that again, to think about. I mean, firstly, you have to
pretty much. Are we due? Are we
due like a global cleansing? No, I think the point is that you have to remember that viruses can be spread by animal vectors as well.
Yeah.
Okay, exposure to various animals and animal vectors can increase the exposure of people to the virus, for instance. So even things like, think about even in more recent memory, things like the Ebola outbreak, and the problems that were happening there as well, and how it was.
Ebola was like skin to skin, right, or person to person. It's not it's not airborne or something.
Yeah, you can catch it through a respiratory way, but it's generally in contact with body fluids. Really, it's body fluids that are the main source. That's not the original vector of the virus, of course, but that it can be transmitted from bodily fluids. But again, it's a matter of how you contain things. In 1918, we did not have the facilities to contain infections, or we didn't have techniques to test people where we could determine they had an infection. So let's take the Wuhan coronavirus as an example. So if there is somebody who we feel may have it, we can isolate them with appropriate respiratory precautions. We can do a blood test with them, which looks at the genome of the virus that may be there. Does it match the one in China? So we can determine through a PCR method if they have it. So there are, investigation, isolation, and public health awareness are really great tools that we have now to our advantage that we never had before. And that really helps to limit the spread of these type of.
But on the other hand, we've got far more mixing and far greater kind of distances people travel across, which kind of go the other way, right? I mean, look at for example, they mentioned what was the name of the virus in 2009 that they called swine flu?
Oh right, yeah.
H1N1.
Yeah.
That they said in the program that infected 2 billion people. And they said it was
people are infected.
It was only kind of a matter of luck that it wasn't that dangerous, or it wasn't that kind
people
of.
People are still infected
harmful.
with H1N1.
Yeah.
Again, and it really depends. I mean, again, we're not caveating the discussion with the fact that is the patient a really poor diabetic? Have they got an underlying lung pathology? Is their immune system weak? Are they a patient on chemotherapy? Have they? There's so many nuances to this discussion, and to the context at the moment for the general population is this thing is killing people and we should be terrified. This thing is killing people like all viruses kill people. People who enter our hospitals in the UK, if they get a significant enough infection from a normal respiratory, we have patients in ITU, in the intensive care unit, and the cause of their infection is a rhinovirus, which is the common cold. But these people are dying because of their underlying conditions, which are preventing them from responding in a way which will cure them. So even the simplest virus can kill you.
Weak immune system.
Yeah, exactly. There are many factors, and a weak immune system is certainly one of them. So again, I'm trying to bring some perspective to this discussion where everybody's like, "Oh my god!"
So be afraid of everything.
There's the
rhinovirus could kill you.
Yeah, exactly. Rhinovirus could kill you.
People in intensive care just for common cold.
Well, exactly.
Assalamu alaikum, guys. Sorry to butt in, but if you're enjoying this podcast, please head over to islam22c.com/donate to help us make more. And if you're not enjoying it, head over anyway and help us make better ones.
But again, those people are alcoholics. They're people who have, or diabetics. People with underlying lung pathologies, chronic smokers. There is a reason these people get really sick. Asthmatics can get really sick as well. So again, just to say, 100 people died, there's no context to that at all. There's no context in the total number of people who've been infected, nor is there context in terms of who are these people, what is actually wrong with them, what is their pre-morbid state. Just to say that they died
the thing that they reported today was someone in Germany being
a person-to-person transmission,
a first-person transmission in Europe. But what they were saying was the worrying thing is. The lady who transmitted it to someone else, she didn't have symptoms herself.
Yeah,
so
and some viruses do have an asymptomatic phase. So if you take chickenpox, for instance, so chickenpox has you're infectious 48 hours before you get a rash, for instance. Obviously, it doesn't really happen in adults as much. It happens much more in children. But actually, when the rash appears, you've been infectious for 48 hours before that, so potentially infecting other people at that point. So it's not a singular event with this coronavirus, the Wuhan one. It happens with other viruses as well. And yet I can see why people are, my wife was like, oh my God, you can't even tell that you've got it. And I was like, yeah, just steady on, because actually that happens with other things as well.
So you told your wife that?
I did, yeah. I said, I explained.
That kind of gives you more credence when it comes to is he making medical taqiyya on it? If you tell your wife, quickly get in the bunker.
Yeah, exactly.
Tell everyone else, nothing to worry about, no panicking.
No, yeah. Secret
Make sure you have 3 months supply of water.
Gas mask monk, gas mask monk. Of course, yeah. No. Don't look at my Amazon order list, of course. Yeah. Please don't look at that.
I think Mahmoud bought everything there.
You would have. Yeah, I'm gonna take some of these things home with me. The biohazard sticker definitely.
Will that even help you? By the way, this thing, it looks like it's from World War I or something.
I think it probably is from. Sorry, probably is from World War I. Yeah. No, and we have very effective sort of respiratory masks that we use. I mean, if you think about it this way, I mean, TB is not a virus; it's a bacterium. Okay. But if you
I knew that.
But if you get on a flight from, let's just say, any TB endemic country, let's just say Pakistan, because we're both from there, okay? So if there is somebody with TB who's coughing on the flight, okay, you need 8 hours cumulative exposure to somebody to contract TB, okay?
Really?
Yeah. So the
flight flight is 7.5 hours.
7.5 hours. Right. You might just be all right, but actually you are at increased risk. So sometimes we do have to, depending on where they've come from, Public Health England have to do some sort of screening for some people as well. And now I'm not saying to everybody that you should start worrying about getting on a flight from Pakistan. I traveled every year and I don't worry about such things. But what I'm saying is, maybe I should. Maybe I should just be paranoid and just live my life in fear. Absolutely. Yeah. But I think what
are you a hypochondriac?
I'm certainly. Am I a hypochondriac? I think I am when it comes to these things.
Too chilled out. Yeah.
No, I think that when you know the actual mechanisms for how these things infect people and how common they are, and what the reality of the situation is, it gives you great perspective. And this is where that
it's kind of weird that your perspective is like, it could kill you, but millions of things could kill you.
That's like diabetes can kill you, cancer can kill you, heart disease can kill you. What are you gonna do?
Enjoy your life.
No, I'm not saying that either. I'm certainly not saying that people. And now my proactive messaging: okay, don't get diabetes, don't eat red meat, don't smoke,
don't eat red meat.
Don't eat red meat.
Whoa. I didn't sign up to this.
I thought. No, I'm not vegan. Okay. But I thought I just pushed out there for all our brothers and sisters who are
celebrating Veganuary.
Absolutely, yeah.
Speaking of Veganuary, I went on a Veganuary thing of everything I ate.
Yeah.
Any meat products were strictly plant-based diets only.
Oh, really?
So I only ate things that had an exclusively plant-based.
So you mean burgers made from soya or something like that?
No, made from animals that had a plant-based diet strictly.
So okay, as opposed to animals eating other animals.
Yeah, no predators, no carnivores.
I think that's a very sensible thing to do. Yeah, I think.
I tried. I don't know what they're feeding chickens in these farms. By the way, like when I was watching this program and they were talking about, some of these, they're kind of really infectious. They call them special pathogens.
Special pathogens.
Or was that just an Americanism?
No. There are some pathogens which are more infectious than others, definitely.
So they were saying, there's no strict definition, but characteristics, extra infectious, cause panic, that was one of the things,
right?
And high mortality rate.
See, you have to think. Again, put this into some perspective. Okay, like take a virus like norovirus, which most people would have heard of, because when you phone the hospital, it says if you've got symptoms of norovirus, do not come into the hospital. Okay, norovirus, you actually need 10.
Is that where the phrase "blinking Nora" comes from?
I've never heard that phrase before.
No, can someone Google that, please?
Yeah, just in case this isn't, but you only need exposure to 10 particles of norovirus to be infected, but it's highly infectious.
Yeah.
But actually what happens is you get a horrible vomiting and diarrheal illness which will disappear on its own. Okay, so again, context is important. When you say something is highly infectious, it can be, but actually for the vast majority of people, they get diarrhea and vomiting, which is not pleasant. I'm not saying it's pleasant, nor am I advocating
it's not life-threatening, basically.
No, in the normal person with a normal immune system who's otherwise quite healthy, you'll recover from it.
But the thing they were saying with these special pathogens is that one of the reasons why our bodies don't fight them off that well is because they originated in animals and stuff.
Right.
And I was thinking maybe this is like the animals getting back at us
for eating them.
No, some of these farms that they were showing were really kind of oppressive conditions.
I see, from like battery farming and stuff like that.
Kind of really, not pumped you back with antibiotics and all that kind of rubbish.
Lana's West.
And
it is. I think that's a great conspiracy theory. I love that conspiracy theory. This is the animals fighting back against their own oppression.
It's just qadar, isn't it? I mean, if you're wrong as a species, it's quite embarrassing for us, right?
Absolutely. This is why you shouldn't eat meat. But
well, if I could come, in my defense, I really do like supporting, all the organic halal things. I'm going to Willowbrook Farm, take my kids there, and that's one near me. But it's like 18 pounds of chicken, man. So that's
man's got to be pragmatic.
Yeah, I've got principles and stuff, but
I
can't resist the Colonel's secret blend of 11 herbs and spices.
But actually, an important point I think we do need to touch on that people should be panicking about, okay, and it's not being killed by Wuhan coronavirus, okay, is people's usage of
norovirus.
No, not even norovirus. Is people's usage of antibiotics. and now that I have a fairly decent platform by which to proselytize my message, okay, I'm going to go for it. So one of
you are anti-antibiotics.
Absolutely. I mean, even with my own kids,
if antis cancel out, you're just biotic.
Oh, I see. Yeah, that's good. I like that double. Oh, yeah. There you go. You got it in. That's
the favorite microbiology joke of 2020 so far.
I will try it with my colleagues tomorrow and see if they giggle. But one of my roles within my job is to actually look at the resistance patterns of the general population and the bacteria that we culture.
I've heard about it.
And in fact, I was doing this. I do this activity annually, and I was doing it today. And what I found was that some of the resistant bugs are increasing. Okay, so the resistance overall is increasing, and the reason for that is that there's multiple reasons.
Bacteria fighting back.
Bacteria fighting back because we oppressed them in some previous lifetime. Yeah, absolutely. But the point is that people go to their GP when their kids are unwell and scream, I want antibiotics because that's what's going to save my child, or even me for that matter. I sit on my kids and myself for about 2 weeks, okay, before I even go near an antibiotic. I mean, there's very few times that I've given either of my 2 kids antibiotics, and they're relatively short spaces of time that they've been alive. But it's because the vast majority of illnesses are virus. They're the more contagious. They're the ones that you'll visit your family, and there'll be some kid with a snotty nose, and you'll touch them and you'll pet them, and all of a sudden you've got it, your kid's got it, and it's all over the place, and those things will resolve on their own. If we start giving antibiotics to people who don't have a bacterial infection, because antibiotics only treat bacteria, they don't treat viruses.
I knew that.
What we're doing, absolutely. I'm sure you knew. You're a doctor, for the love, so of course you knew that. So
not a medical doctor. Though.
No, I know, I know. But as my younger sibling, as my younger sibling keeps telling me, the real doctors are the PhD doctors and not the medical ones. Yeah, anyway.
But you've got a doctorate, right? Don't you have to have one if you?
No.
Oh.
No, fortunately, awkward. I don't. I can claim to be a proper doctor, a medical one. But usage of antibiotics when you don't need them, all it does is it increases resistance, and actually wipes out the good bacteria in your gut, which are there to protect it.
Yeah.
Okay, so using antibiotics willy-nilly, and when you think that you know better than the GP who's seeing you and telling you actually this is a viral
sometimes
infection.
the GPs just prescribe it willy-nilly, don't they?
Well, I mean, I'm not going to comment on the individual prescribing practices of my colleagues in general practice, but I know certainly firsthand
loyalty and stuff. I can respect that.
It's yeah, this is when my yeah, exactly, absolutely. But no, I'm not saying that there may be some people who may have that practice, but I certainly know from my colleagues in general practice in the area that I work that they do resist quite hard. In fact, one of my colleagues was the other day, he was telling me about a mother who came with her children, and she literally refused to leave the surgery until he gave her a prescription for antibiotics. And he said very categorically that your child has got viral infection, it's not bacterial, please, you don't need antibiotics. But this mentality and this culture, especially because, ultimately we're Pakistani, what happens? You go to Pakistan, somebody gets a sniffle, oh my God, you didn't take antibiotics. I'm like, yeah, but you didn't need them, but that mentality seems to exist in our populations even more. So I think one thing that I really would implore people, if you're going to do something today, is instead of worrying about dying
look at the camera and give an impassioned plea to the
absolutely. Instead of worrying about being killed by the Wuhan coronavirus, please think about your antibiotic usage, okay? So trust your clinicians. If they're telling you that it's a viral infection, go with it. I'm not saying that you
just
can't
panic,
become...
but panic about antibiotic resistance.
Because, no, I'll be honest.
So you need to buy a bunker.
Yes.
Go to B&Q, get some shovels, hopefully underground, and stock it with antibiotics.
But you know that we have organisms now that we can't treat. There is not a single antibiotic in existence.
I've been called worse.
That can... that can treat them. So this is a real issue, and it is something that we should be more conscious of, because the more this becomes prevalent, the harder it's going to be.
A medic once told me though that even for a viral infection,
yes,
prescribing antibiotics allows the immune system to focus on the virus part rather than the bacterial whatever.
I don't know.
I was like, that sounds a bit weird to me, bro.
That almost sounds like black magic to me, or something like that. Sounds
Kala jadoo.
Kala jadoo. That sounds questionable practice to me.
So how do you know if you should go to the doctor or not? Because someone was talking about just different cultures as well of medical practice. So my brother Mahmoud was saying that he found with American brothers and even doctors and healthcare kind of professionals they have a tendencies to
That's because
prescribe.
That's because they've got a private healthcare system, and over investigating, over treating, brings in the peas basically. So
even for medics, they don't have that kind of camaraderie.
No, we don't. So we work for the NHS. We work for the best healthcare system in the world, my friend. Okay, don't.
It's going to be privatized soon, though, right?
Well, we'll see.
Part of it already has.
Part of it already has. But I think we were just having this discussion some of us the other day, and we were talking about there was a plan from an American specialist about treating something, and they said, we were talking about urinary tract infections and how you'd investigate them when they got to a certain point. And the American Association said that we would advise doing this investigation. We unanimously agreed that this was not a sensible investigation to do at this point. Rather, it was something which was probably more, linked to the fact that it brings in some, and not to say that the investigation was completely futile, but it was an over investigation which wasn't necessary at that particular point of the diagnosis. So I think the practices do vary. You're right, depending geographically where you're from. So doctors in the UK, doctors in Europe, doctors in US, doctors from Pakistan, India. I mean, everybody will have slightly different practices, and there are different guidances.
Our boys are the best.
Of course, British listeners.
Okay. I can buy that because I'm from here.
Yeah, well, there you go, exactly.
But
there's well off for
I mean, it makes sense, if there's a culture where people are encouraged to prescribe things because they, drug companies are making a profit out of it. But isn't that happening in the UK as well? It's just that we're not the end consumer. The patient isn't paying for it, but someone is.
You're right, but lots of our treatment is guided through a central body called NICE. So especially medications which are for.
And with a name like that, they can't be terrible people.
They can't be.
They thought this through.
Do your drum thing. Go on. That deserves it. There you go. Do your drum thing. But I think we have regulatory bodies, and that's not to say that other countries don't, but ours are very, very specific, especially when it comes to high cost medications. What is the cost benefit? Are we going to be achieving what we need to be achieving if we sanction the use of these medications?
I mean, it's got to be done. I mean, it's not a very nice conversation, but it has to be had by some people, isn't it? Is it worth saving this person's life? It's going to cost too much money.
I think those ethical questions are important. I mean, it's not to say that we, and you'll know obviously that recently the case about ventilating that young girl who was taken over. I've forgotten.
Tafida
that's right. Yeah.
Begum?
Is that her name? I can't remember.
Tafida Raqib.
Yeah. I've forgotten her name, but to the fact that she then obviously went to Italy and then had her ventilation supported, and now she's off the ventilator. I mean, everybody makes a risk assessment within their own practice. So I'm not criticizing one group of people, nor am I, praising the other one. Everybody makes a decision on what they feel is the best point at that time. And people, it's not to say that we're infallible. Of course we're not. We can make mistakes, we can be incorrect, but what we try to do, especially in difficult circumstances, is to try to come to a general consensus amongst multiple people. So, if I have a really difficult case, I often go and talk to my colleagues about it and say, what do you think? Is this reasonable what I'm doing? Just because we're consultants doesn't mean that we're infallible, or that we can't make mistakes. We can. And every week, for instance, my colleagues and I, we sit down, we talk about what we consider to be difficult cases that we're dealing with, so we get other people's opinions and see, what do you think? Are we, are we doing the right thing, or could we manage it slightly differently? And we, everybody always has an opinion, and we collate those opinions and come forward with the best.
Assalamu alaikum guys, me again, reminding you to head over to islam21c.com/donate to keep the lights on Islam 21c. We pride ourselves on being independent and being funded by the grassroots community. Do you think the NHS is ready though for if there is some kind of la qadar Allah big outbreak?
Yes.
I mean, it feels like it's stretched to the public services are stretched, including the NHS. Tory kind of austerity.
Austerity.
You're
I love the fact you got Tory austerity. Yeah.
I have to say that at least once in every episode.
I genuinely appreciate it.
But I mean, are we prepared for because in the films, obviously Hollywood and kind of even news documentary type thing.
Yeah.
They show like people whose job it is in head of preparedness for infection events or something.
Yeah, so it's part of the public health's remit to make us ready for those eventualities. And certainly from the documentation that I've read, and again, I don't read documentation on every virus or bacterium from Public Health England, but certainly I've been obviously reading about what kind
cut that bit out.
What kind of thank you. Can you just cut that bit out?
I'll keep your job.
Yeah, absolutely. But certainly, I've been obviously reading what Public Health England have put out about
only the rock star viruses.
Oh, of course, only the rock star viruses. Only the cool ones.
Yeah. Come from animals.
Come from animals. And certainly the mechanisms that they have in place to deal with it seem brilliant. I mean, it sounds like they're
what? Give us some hope here, bro.
I mean, so knowing, for instance, that a flight is coming from a particular country to that if there's somebody who develops symptoms,
divert it to France.
Yeah, we could divert it anywhere actually.
Calais.
But to know in advance in transit if there's somebody who's unwell, to have, there are designated staff who would attend, like a port doctor, a specialist, other people, they would take samples. They, even to the point that it's mapped out, they would go to a separate runway.
Wow,
There's lots of detail, which I think is obviously Public Health England, have responded in a really, really good way to it. And I think from all objective parameters, it seems that they are prepared. But unless an outbreak actually occurs, you don't actually know if you're fully prepared because you don't know.
They do like dry runs and like drills and stuff.
Certainly we do. And I remember when the Ebola outbreak happened, we had dry runs in our hospital. So we thought, okay, if a patient comes who's query Ebola, what are we going to do? So they would gown up, talk about how they would transfer the patient, how would the samples be couriered from one place to the other, what box would they have to be, all of this stuff gets discussed.
It's important to see what kind of preparedness kind of the public bodies are practicing with, not like this is how we dig mass graves and keep everyone and big massive incinerators and burn everyone to ashes.
Unfortunately, I have not read any documentation on that part yet, but who knows? But yeah, again, I think
that's what the kind of stuff they had to do like 100 years ago, right? So in 1918, like people just people in mass graves and stuff,
and they used to sort of burn bodies and to try to limit the spread of infection.
Crazy, but really scary.
Yeah. But I don't think England's big enough for mass graves anymore.
It's all those bloody foreigners coming over here, taking over our mass.
Brexit may actually help this problem. Yeah. We may have more land to have mass,
to kill ourselves. Yeah.
But yeah, I think the short answer is that it seems that we're well prepared, but unless an outbreak happens, you never really know.
Yeah. But like people are always saying, it's a matter of luck / divine, mercy that we haven't had a serious pandemic, right, or epidemic globally, because
absolutely
historically, I mean, I know historically those are the things that kind of stand out.
Yeah, absolutely.
People write in history books that millions of people died because of this plague or whatever, bubonic or Spanish influenza or whatever. Historically, I mean.
But I think what you have to do is you have to remember now that because of the way technology has changed, our information is much better on our responses. And it was really interesting. There's and I can't remember the name of the young lady who I went to a conference, and she was presenting her work on the use of social media to predict epidemics and pandemics. So she said that when the I can't remember which outbreak she was talking about. It was a foreign outbreak, but she said you could have predicted it 3 days before the onset because of the way the symptoms were trending on Twitter, and that was her PhD that she did it on. I thought it was fascinating.
Algorithmic vaccination.
Algorithmic. I mean, she said you could have predicted that it was going to happen just from the way it was trending on Twitter, or the way that people were talking about the symptoms on Twitter, which was fascinating. I thought that you even before we tested people and we the WHO declared pandemic, you could have you could have seen it.
Information out there.
Absolutely, and I think if you go back to 1918, we did not have Twitter or Facebook or all the various forms of nonsense social media that we have now.
I'm always cussing social media, but that's something good that you've done. Very well done.
See,
yeah,
social media can be a friend.
Hashtag itchy rash and cough. One brother, he that I know, he quite well. He works in a company that works on using some of this algorithmic data and looking at trends and
Cambridge Analytica.
He does it for a commercial purpose, so like advertising and stuff.
Sure.
At the dark side. But he was telling me about a story where a man was stormed into Boots with his 12-year-old girl.
Right.
And he was so furious. He's like, "Why are you sending my daughter pregnant care and childcare vouchers and stuff in the post?"
Right.
And they were like, "Sorry, it must have been some mistake. We don't know. Sorry, it won't happen again." And a few weeks later, she found out she was pregnant.
No.
So the algorithms for all those
That's
advertisements,
crazy.
they knew from her search history, from all that kind of stuff, machine learning and stuff, that she had a high likelihood of being pregnant herself because of the stuff she's
doing, visiting and looking at, and
she's probably googling, what does it mean if I don't have I'm puking or I'm puking in the morning or whatever. It correlates all these things together. Absolutely. So it's very valuable information somebody has out there. Obviously, it's been kind of hijacked.
So we're agreed that we can ban things like Snapchat and Instagram, but we can keep Twitter.
You're right, mate. You're right.
Yeah.
And Google, we used to give us some of that.
As long as they pay their taxes, I don't know.
As long as they start paying their taxes.
Yeah, absolutely.
Speaking of, so you're talking about antibiotics. You're really kind of anti-antibiotics, but I'm assuming you're not anti-vaccination and stuff.
No.
That's a kind of whole different kettle of fish.
Certainly not anti-vaccinations at all.
Maybe get the wrong end of the stick here because... And I've heard a lot of stories about, and there's movements, against...
The anti-vaxxers,
anti-vaxxers and stuff.
Yeah.
And part of me thinks, what the hell are you doing? You're putting everyone at risk here, even your own children, other people's children. Another part of me thinks, fight the power, fight the machine, the big pharma and stuff. I'm kind of conflicted. What's your position on that?
I'm a doctor that deals with infections on a regular basis, so I'm clearly in the pro-vaccination movement, and I get myself vaccinated.
So every single vaccine that NHS England recommends, do you think that taking that vaccination is better than not taking that vaccination, to put it bluntly? In terms of the whole, what do they call it?
Overwhelmingly, yes. Yeah. I mean, I think you're asking a question where there could be one or two sort of nuances to that, which you may feel actually you may consider on a risk sort of a benefit sort of basis. But otherwise, I think that if public health are advising you to take vaccinations against a particular illness, you should do it. And I get my children vaccinated against everything. I mean, there are some things, obviously, that there are vaccines available which...
Our choice.
I mean, ultimately, all vaccines are a choice. You don't have to be vaccinated if you don't want to. But I think the outcomes of that is what we're seeing now. So that generation, for instance, whose parents thought our child is going to develop autism, I'm not going to vaccinate my children. Those are the same sort of young people that we're seeing with clinical measles mumps. I just had a young man the other day with a mumps meningitis, which is not common at all. But in fact,
so there's data to actually show that these diseases are making a comeback?
Absolutely, yeah. We've seen a massive. I mean, if you look at the data of public health, there's been a massive spike in measles, for instance, and we hadn't seen measles in that way for a long time. We were declared measles free, and we're not anymore.
And do you think that's because of the choice people have?
Absolutely, but
But I think people should still have the choice or should they be forced?
Do I think people still should? I think this is an interesting ethical question. I think the part of me which wants to protect the general population, I feel choice is an important thing, but there is something about protecting other people. If your choice is always limited to just you, that's one thing. But actually the choice of vaccination is not just limited to you, it affects a whole raft of people. You know, so for instance, let's say that there is a parent, okay, and they have a child who is immunocompromised for some reason, okay, and they have chosen not to vaccinate their children against measles, mumps, rubella, one of the infections that we can vaccinate against. And the child that is well, okay, catches measles from somebody, okay, and then their child who's got a poor immune system at home, it could potentially kill them. You know, I mean, that's what we're talking about. So even though you think it's a personal choice, it's not necessarily a personal choice. You are making a choice not just for yourself, but for everybody else around you. And it's the same thing in hospitals. As healthcare professionals, we should all be vaccinated against influenza, not because it will save our life, because potentially it will save the life of one of our patients. So there is an ethical consideration around that. Now, I do want to touch upon this point because I'm not suggesting that if somebody receives a vaccination, there could not potentially be an adverse effect to it. Okay, it is let's consider it a medication like any other medication. Okay, if you put an exogenous substance inside of your body, there is a potential that you will have a reaction.
Exogenous
meaning, you know, from like it's not internal to you.
I know. Sorry. The dumb people. I don't know.
But I mean, like for instance, my son, he just had scarlet fever. Okay, so he received our own Dr. Salim. My son prescribed him some antibiotics, and he's had. Did
you tell him not to take them?
No, I didn't. I didn't know he had scarlet fever. He needed to take them, but he's had quite.
What is scarlet fever? Is it quite serious? I need to know how many jokes I can make about this. If it's like.
Potentially can be. But the point is that he's had quite terrible diarrhea with it, and it's a side effect. Okay, he needs the antibiotic. He's having a side effect. Okay, he'll live with it.
I'm sure he'll appreciate you mentioning that in front of everyone.
He's 6. It's okay.
Embarrassing dad.
It happens. Lots of people get side effects with antibiotics, but I think that the point is that
because it affects your gut biome, right?
Absolutely, antibiotics can affect your gut biome. Absolutely. See, they don't put you doctor.
Not just a pretty face.
So I think the point is that any drug can have a side effect. Okay, and there are people who may suffer adverse outcomes because of having had a vaccination. I'm not suggesting there won't be, but for people to jump on that and say, I know that my friend's son or my friend's daughter or my friend's child had this side effect, so I'm not going to vaccinate my children. That's just like saying, his son had an allergic reaction to penicillin, so I'm not going to give my child penicillins for the rest of my life. It's sort of equatable in the same way. And because there was now that fully discredited sort of piece by Andrew Wakefield about MR vaccination, people sort of jumped on that as well. But that's
partly the media is to blame as well.
Oh, of course, the media doesn't caveat anything, doesn't nuance it. It just presents information
for the next story, sell papers or whatever.
Exactly.
Okay, but I mean, someone might say, what about if it's my kids?
Yeah.
I'm gonna give them, lemon tea and haldi or whatever. I'm gonna boost their immune system using traditional means. If it's my kid, it's my choice. I'm not harming anyone else's kids that way. I
think the word is ahlan. You can do whatever you like. There is, there's no compulsion like Rafiddin, not in the dunya in that sense. Nobody can force you. Exactly like Rafiddin. So there's, nobody can force you or your child to give them a vaccination. But even if you think about it from a religious point of view, okay, the protection of many people from something which in the overwhelming majority of cases is going to have absolutely no effect on you at all. Yeah. You have to think about that, that you will be saving somebody's life or potentially protecting other people.
But if those other people, if they're vaccinated, the argument goes then...
Because of the herd immunity.
But if someone else is vaccinated, then you're not.
Absolutely, but if everybody takes that approach, then people just stop vaccinating in total. So you'll lose your herd immunity that way.
What's herd immunity? Can you?
So herd immunity is basically when enough of a population is vaccinated against a particular illness that it provides protection to others by virtue of the fact that they're not getting the disease themselves. So you're providing sort of mass sort of protection. But obviously now that we've had this whole group of people who were anti-MMR, now you're seeing, now we've lost our measles-free status as a well, you tucked, but that's a big thing,
that's a sincere tuck.
Was it a sincere tuck? I wasn't sure. I had to check.
Quite embarrassing.
I had to
as a nation,
actually, that we lost our measles-free status. So I think and now what's happening is those people, are potentially infecting other people. So now what we have is a situation where if somebody walks into an ED department with a rash, we have to isolate them from point zero because of the potential for infecting other people who may be sitting in the waiting room who may be immunocompromised or diabetic or something like that. I mean, it has
to more, that takes up more resources.
Absolutely.
And stretches them.
Absolutely. Then we have to test them, outside of the normal testing parameters. We have to isolate them. It takes up a side room where actually they may not have these issues at all. So this is. So
are all vaccinations the same then? Remember my kids, you have a little red book, and then it tells you this week get this vaccination or whatever. Are those vaccinations all, would you say, compulsory in your opinion?
I consider all vaccinations compulsory, and I'm not going to. I don't think I would suggest one is less compulsory than the other. I think that's the wrong way to look at it.
So do you know how many there are that people should have?
Oh,
so, I don't know if
off the top of my head. How
do you know if you've had all the vaccinations
at your age?
ones?
The one way that you could do is to have a blood test, which tests whether you've got antibodies to that to that infection. So we can do that.
Is it like a general one people can have?
No, it's not a general one people have. You have to if you're particularly worried whether you've got immunity to that or not. Firstly, people of your age, because I have a record, so you should have a record because you're younger than I am. And if you don't,
it's all on the system, right?
It should be on your GP. It should be it should be on GP
records. Badges or anything?
No. It should be on your GP records, because mine are on my GP records, for instance. But if I wasn't sure, I could, if I was really keen to find out, I could have a blood test which would tell me whether I've got immunity or not.
So you're pretty strong on the whole get vaccinated.
Yes. Oh yes.
What would you say to someone who says, the vaccinations might contain some pork products or gelatin or whatever?
Okay, so this is an interesting,
Muslim, obviously.
Yeah, this is an interesting discussion, and I think it really depends on which side of that discussion you sit on. I think if there's a viable alternative, obviously you should take the viable alternative, and if there's not, and again, I'm not a faqih, I'm not here to make any judgments or pass any judgments. You should go to an alim that you trust, and you should take their advice on the matter. For me personally, this is an issue of maslaha, so I would advocate taking the vaccine if there was none other available, because there is a great benefit in
like fuqaha have gotten together in councils whatever with medics and hashed this stuff out.
Some people have and some people haven't, and I think there is still a great diversity of opinion on this issue, but again, just to make a shout out to the British Islamic Medical Association. They've been involved in looking at some of these things. They're still looking actively at some of these things from a wider perspective for the Muslim population, which I think is important. But again, you'll find diversity of opinion in everybody. So organ donation, for instance, highly disputed topic. And you'll find difference of opinion on these issues, and that is the standard fare of being Muslim in many ways. You'll find diversity of opinion.
So alongside vaccinations, what else do you recommend for people just to, be safe from the plethora of things that you just described?
Absolutely. So I think
apart from making all your du'as in the morning and evening.
Of course, morning and evening. Of course, that first. Of course, tawakkal on Allah firstly. But then obviously you have to tie your camels a little bit, okay? And it depends on yourself whether you're a big camel tie or a small camel tie. So if you want to slaughter them and eat red meat, I think that's a bad idea. If you're happy not to eat meat, I think that's.
What's so bad about red meat, man? Come on.
There's lots of things. Don't even get me started. What's bad about red meat? I'm not saying that you shouldn't eat red meat at all. Really? You should eat it in
just once a day.
I would say once a week. Once a week probably is the most I think that people should be eating red meat if they're eating at all.
What, too much
for many reasons.
Fat?
It's from a cardiovascular point of view.
But not about kind of infectious disease. Or
no,
anything.
not necessarily. But you have to remember that if you become more predisposed to certain illnesses, so people don't treat diabetes with the respect it deserves. Okay, and I used to think. I remember when I became a medical student, I thought, what is the one thing that I would be really, really afraid of happening to me? And the first thing that I remember thinking is if I had a stoma, and I'm not going to go into the details of what stoma is, but when I learned about diabetes properly, I was like, okay, this is the one thing that I definitely would not want in my life, because it can knock out your kidneys, your nervous system, your eyes. You can become blind from. There are so many complications, and it's an immune suppressing illness. People don't understand that point. That diabetes makes your immune system much weaker. So if your lifestyle is positioned in a way that you are making yourself more susceptible to becoming diabetic, for instance, okay, you are causing inevitable damage to yourself. It's because if somebody is, there are a few people who are diagnosed with diabetes, for instance, and they're very good with their diet and they manage themselves without medications, and that's obviously a good place to be. But if you're not conscious about your diet, okay, and I think this would be, and you're saying what else could we think about? Diet, exercise. I know that people say
general
these things
health.
a lot, but general health is really important because it really helps maintain your immune system. And I'm clearly a father and not a mother, and I know that mothers are very protective over their children, but exposure of children to the wider environment is important. If you keep your children sort of mollycoddled in a very surgical way, and I don't want them to catch this and catch that, you're actually not giving their body a chance to develop its own immune system. Exposure to other children, for instance, they'll start developing antibodies really quickly. So if you kept a child in isolation in a very, very sort of surgical room with no exposure to anything, okay, if you expose them to the slightest, smallest virus, it could kill them because they're not developing their own immunity.
Assalamu alaikum guys, last reminder I promise. Head over to islam21c.com/donate to help this movement get to the next level. So we have genuine, high quality media articulating Islam in the 21st century and developing confident Muslims impacting the world for the better. So do you think it's good then because one really annoying thing I find, unfortunately about our own community, right? Generally I find among Muslims and I think even more amongst Pakistani people is just not covering their mouths when they cough and sneeze. I find that really strange. Like, me personally, when I see someone coughing, especially like in a masjid or something with crowded people,
I'm about to put my nose in the floor, my friend, and you're coughing all over the
And but does that help?
Of course. Because lots of most viruses are not most, but lots of them are droplet mediated.
So if because of this lack of what I would regard as basic hygiene,
it is basic hygiene.
Does that help boost your build your immune system because you're being exposed to all of this?
Yeah, I think in some way it does. To be exposed to viruses is now this is going to sound terribly odd, but there is overall a benefit in it. If you think about it, vaccination is exposing somebody to small amounts of a virus or whatever the underlying microorganism is to give your body a chance to develop antibodies to it. So there in itself is the reason that we vaccinate people. So exposure in general is, I'm not saying go and find somebody with measles and rub your face with theirs. I'm not in the Maori way or something, touch noses or something. I'm not suggesting that you do that either. But what I'm suggesting is to surgically protect people from, unless they're immunocompromised, that's a completely different scenario. But if you're not, letting somebody's immune system develop naturally is really important. Otherwise, you end up in this rather precarious situation where you're always having to give your kids antibiotics and always worrying about why they're becoming unwell. It's because you don't expose them to the world.
Let them play in the mud and
if
outdoors.
if your wife will let you, okay, if the HQ will allow you to do it, I think it's a good thing. I'm not saying rub their face in the mud. What I'm saying is, but just let them be exposed to nature.
Mud has antibiotics.
Yeah, apparently it does. Yeah.
Mud has antibiotics in it.
Well, they say it has antibiotic properties.
Okay.
Yeah, antibiotic properties.
In immunology, when I did that as a back at uni, that was a mind-blowing, man. And even now, recently, I've seen some videos. It's become much more detailed than it was back then.
Absolutely.
And it was amazing, like mind-blowing stuff. And subhanAllah, the way that our immune systems are set up just to trigger off a cascade of different events.
Events that release
amazing
factors that protect you. Absolutely, yeah, absolutely.
But I still get really annoyed when I'm sitting in the masjid and I hear. I actually went through some of looking for some. Yeah, that one. And there's this one. I think this is a special virus. Those are the ones you hear in the wudu area, isn't it? Sometimes, and people are trying to clean out their esophagus and stuff. But I really get annoyed when I just see.
Yeah, I mean, I think.
I mean, now that you mentioned, being exposed to pathogens, I kind of feel maybe there's wisdom in it. But
what I'm saying is that you have to remember that at the same time, it's not good to actively infect other people. That's the other part of it. But
the problem is that people that often do it are like elders and stuff, and you can't really say anything to them.
Absolutely.
But it's really, sometimes I get really angry and I can't say anything to you.
No, but I know lots of young people and somebody who I know very well. Whenever I see them sneezing, I'm just like, why are you not covering? Why are you infecting the masses? And not because it's going to be harmful in a major way. It's just inconvenient to become unwell. If you get a viral infection, you've got snotty nose and running eyes, you just don't feel well. You'll recover from it.
Or if someone's immunocompromised, then you could have just handed them a death sentence.
Well, yeah, you could make them very unwell. Absolutely, you could make them very unwell. So those are things to think about.
I mean, especially with Muslims, I think we need to be careful because, especially brothers, we come and pray together and we go to the masjid and families go to Umrah and Hajj, and there's a whole melting pot of all kinds of pathogens and stuff from all over the world.
Yeah, I mean, absolutely. I think that I think that people need to take a slightly pragmatic approach when they're quite unwell. And I often say to some of my colleagues when I see them, like they look deathly unwell, and I say, why are you at work? Not just for yourself, but what about the patients and your colleagues? I mean, you're sick. It's not a good idea to be. Because I know that people, have a very good work ethic. But,
here's a pro tip. Mahmoud, who's currently holding the camera, say hi, Mahmoud. He said that in Hajj, somebody gave some advice that the proper way to cover your mouth as a Muslim when you're sneezing and coughing and stuff, because you shake hands and you give hugs and stuff. So the better way, instead of coughing into your hand, is to do this.
Into your sleeve.
Yeah, or into the corner of your. So make your arm crooked like that. And he said when he heard that advice, that was the one Hajj he didn't catch something.
Oh really?
Yeah. So
I mean,
it works.
Obviously, because he's in that sense he's right. The transmission is much more likely from the hand. So absolutely. But sneezing into the corner of your.
Unless you kind of linking arms with someone when you're doing doing tawaf or something.
Yeah, exactly. Yeah.
But I also found personally that echinacea for me really helps. I used to get a lot of sore throats and tonsillitis really bad. Mm-hmm. But every time now I feel a bit, when I feel like the something is coming, a cold is coming. Yeah. I have some echinacea tea at home. Right. It's just some herb. Apparently it's supposed to boost the immune system. But I find it really kind of increases phlegm production and stuff. Right. So it feels like it just flushes everything out. It just flushes everything out.
I mean, I'm very pro sort of natural sort of remedies. I'm not that I go around telling everybody to use haldi and doodh. I'm not.
Wait, what's wrong with haldi and doodh?
Nothing. Because my wife is a great proponent of turmeric. Yeah, absolutely, and milk, doodh's milk. So my wife is a big proponent of that when people have got sore throats. But I mean, I believe that there must be some relevance to these things. I mean, I remember I took a trip to Pakistan.
They're based on like some of the thousands of years of sampling, so
absolutely.
It's quite scientific.
If you look at some of the medicines that we have, like digoxin, which is used in fibrillation, atrial fibrillation, I mean, it comes from the plant, essentially. So, and I remember when I visited Pakistan in 2011, I visited a lab there, and they're doing some research on black seed. So what they did was they covered a plate in MRSA, that superbug, and they put a small disc which was impregnated with black seed oil, and they incubated it. And the next day, the MRSA wiped off the plate completely. Killed it.
This sounds like one of those kind of pictures you see on social media.
No. I visited the lab. I saw that.
Subhanallah.
No. It's not that, but it's a way of to demonstrate to the people who don't believe in these things that they do have medicinal properties, and I firmly believe that they do. Now, in what way that they can be utilized for that purpose, that I'm not sure about, but I will never deny that turmeric, black seed oil, honey, all of these things, they do have medicinal properties, and I think that's important.
Subhanallah. You're just pardon?
Kind of kufr if you like deny that anyway.
Yeah, no, exactly.
You kind of have no choice.
Yeah, I have no choice. No, absolutely.
Sunnah, brother.
It's Sunnah, but I do personally believe, that they do have medicinal properties.
I mean, one of the arguments by the people who are against kind of vaccinations is kind of similar to what you, a little bit what you say about both antibiotics and the kind of the American style of just.
Right.
Prescribe first, ask questions later. Because is there not a commercial kind of interest behind all these pushes for vaccinations or any kind of drug or whatever?
I think if you're going, I think there are people who look at all of these things exceedingly cynically. And the answer to that question is that I'm sure there are. Nobody does anything for free. Nobody does. Nobody. I mean, what I mean is. In business, obviously. I mean, these drug companies do not produce these medications for the sake of the world. Okay, they are there to make money. Yeah. So there is no doubt that that type of thing, is the driver for why it's happening. The way that our public bodies advise on schedules and on vaccination is not triggered by the drug company.
Are you sure about that?
Yeah, well, as sure as I can.
Dealing,
right. So as sure as I can be.
Austerity.
As sure as I can be.
It's not like a conspiracy theory to highlight the fact that there are, deals that happen. There are kind of.
There may well be.
For example, I mean, there are always interests. I mean, there's an amazing book called Parliament Limited, right?
Okay.
It highlights the whole culture of MPs having other interests and being on this board and that board and revolving doors of seconding kind of from one company to this department in the government or whatever. So there is a commercial kind of element to everything. Whether it's building homes, because a lot of MPs are private landlords.
I'm not going to dispute that for a second. I'm not going to suggest that doesn't happen. But at the end of the day, I can see firsthand what happens when people contract these viruses. And if taking the vaccination prevents this from happening. It's like a no-brainer. People think, I'll get measles and I'll get over it. Actually, you can get quite a severe pneumonitis and die from that. Many years later, you can get a brain infection. It's a latent infection that happens because of measles that can kill you. So there's lots of practical issues around this. There's other. Would I be absolutely vociferous in every single vaccination? Possibly not in one or two, but the overwhelming majority, yes.
What others, one or two?
I'm not going to mention them. Yeah, but
keep your job. Yeah.
No, it's not nothing to do. It's not even my job. But I mean, that's a personal view of mine.
Okay.
But let me say that 99.
Get sued by anyone?
No, it's not. I wouldn't get sued at all. But 99% of vaccinations, I think, which are advised to the public, and for certain groups of people, I'd say 100%. For certain groups of people, part of it is linked to people's activity as well.
I think I feel the urge to say that any opinion expressed in this podcast should be taken as advice only, and to seek any medical
absolutely
blah 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 yourself.
Absolutely. I'm one clinician with one opinion. There's other people. Yeah.
But I'm just saying that so I don't get sued.
No, people should always seek medical advice from their own medical practitioner.
Get a local fatwa for local.
Absolutely, from their own local fatwa. Absolutely, but no, I mean, like I said, I'm completely pro-vaccination, and I think that the conspiracy theories about whether it's true or not, okay, you cannot escape the clinical issue, which is if you contract one of these illnesses, especially in adulthood, they can potentially be fatal, and
so the summary you would say is for the kind of anti-vaccination stuff that there might be some evil company making money out of it, but we're prescribing them, we're encouraging them because there are clearly more benefits than there are harms.
Absolutely, and again,
and for a much wider kind of societal
absolutely,
level.
and a much wider. So again, let me be clear. I'm not suggesting. I think everybody should, but it is everybody's individual choice whether they do or not. Okay.
If you don't, then you're
if you
evil.
don't, if you don't, well, I didn't say that you did. I didn't. People can infer what they want from what I'm saying. But even and I'm not going to say that there may not be.
I'm joking, by the way. I have some family members who don't do that. I get excommunicated or kicked out of the.
No, he really does believe that. No. But the other thing is, and I'm not going to suggest that there have not been any cases where people may have had an adverse incident from a vaccination. But if you think about the total population that's vaccinated, it is a vanishingly small number.
Yeah.
Okay, so. Again, knowing that I was getting my kids vaccinated, I realized that there is a potential risk of giving them a substance which is not natural to them. I
what about
that
seasonal flu vaccines?
Seasonal flu vaccines? I think it's an interesting one. I think healthcare professionals all should, absolutely.
Yeah.
In terms of other people, I think there are definitely people within risk groups who should. Pregnant women, diabetes, chronic lung diseases, chronic neurological disorders, the immunocompromised, well, actually not all the immunocompromised, immunosuppressed people can, but certainly there are definitely groups of people over 65, for instance, that should get the vaccine because the chances of them becoming more unwell if they contract it are much higher. Or in children, for instance, children is a different issue because they pass it amongst themselves so quickly, and then they can affect sort of large swathes of people very quickly. So I can totally see the logic in giving them the vaccine in whatever modality it's given. So do I feel that people I'm different because I'm a healthcare professional working in a hospital. Do I think other people need it? Not necessarily. I mean, people have flu all the time, and they'll get better from it. If you wanted to get it and you wanted to pay for it because you weren't eligible for it, I don't think there's any harm in doing that at all if you wanted to try and protect yourself. But I think
even if it's just to save the nuisance of
but being that would be entirely up to you. I think there are some people who definitely need it, some people who should have it.
Is it better for your immune system if you just don't have it and catch it and then you fight it yourself?
Yes, absolutely. I think in some ways it is always better. There are some instances where getting a virus, depending on how old you are, what situation you're in, is not a good idea, and you should try to have preventative strategies before that. But in general, having natural immunity is always a better thing, I think, as a personal opinion. I know some of my colleagues, they give their children vaccines for chickenpox and stuff like that. I mean,
chickenpox has a vaccine?
Yeah, it does.
I thought you're just supposed to have parties when one kid gets it.
Well, that's what we do in my family. As soon as I figure out that one kid's good, I said, send the others who haven't had it, that type of thing. Okay. I mean, it's a pain for parents. I mean, it's just a practical issue. It is a pain. Yeah. So my son had it, but his wasn't too bad. When my daughter had it, she was really quite upset with it. So that's the thing that parents are just trying to, prevent the stress.
Well, let us know at home in the comments if you vaccinate your kids. I want to try and find out.
I'm going to go massive.
I want to find out if if there's a big movement among Muslims, because if what you're saying is true for the resurgence of measles and all kinds of ancient, they used to be ancient disease, and then that's quite a serious risk for our community. If we're not protecting our kids from that.
It's a serious risk for everybody. Yeah. It's a serious risk for everybody that we come into contact with, and I think that is something that we need to bear in mind. So ultimately, especially our deen is not something that focuses on just oneself. There is something about the protection.
I mean, there is the argument that, Islamically, I can totally see somebody saying, this is obligatory on you, or you have to force people to have this, because if it's actually going to credibly save huge harm, save you from huge harm potentially, and the side effects or the nuisance of having it is so small, then you could I suppose make an argument.
Absolutely. I mean, I'm clearly not going to give a fatwa on this issue. Woe betide me, and I think I'd be inundated with hate if I did. But yeah, I agree with what you just said. It would be, as far as I'm concerned, on a personal level, it's as close to obligatory as you can get.
But have these things been tested properly on? Because the way we're talking about now is as though it's like a hard and fast science, a hard and fast kind of factual thing, but science isn't really like that. Everything's kind of probabilistic, right? And you look at
sorry, what being tested, for instance?
So the vaccinations on different types of people, for example,
right?
You might say that here are here are the bad side effects.
Right.
But has that been properly tested out on different types of people, including like immunocompromised people?
So there is very clear guidance on what vaccinations. There's a book which is, anybody can read it. It's called the Green Book on immunizations and diseases, and you can look up all the different types of vaccinations, who they're appropriate for, who they're not. There are definitely exclusion criteria to those as well. There are some people that you cannot give it to those people, for instance. But if you think about it, we've had years and years and years of people receiving vaccinations, okay? And like any drug, okay, if you get an adverse event, it needs to be reported in a particular way. So that data is gathered really robustly, and so we know what the potential harm is from these things.
The ones that have been around for years.
Yeah, absolutely. So MMR has been around for years, you know, so we know what the consequence. I'm just using MMR as an example because it's the most common one in people's knowledge. Okay. So yeah, I think that data is collected very robustly.
Yeah. Okay. Jazakallah khair. So bringing it back to the coronavirus stuff. Okay, so your takeaway point is don't panic about the coronavirus. It's all happening all the way in China, and there are far more
important
things that could kill you right here at home.
Yeah, I think let's not worry about anything.
That's his empowering.
Let's
don't panic message.
Don't panic. No, I mean, I think our risk stratification for Wuhan coronavirus is low probability. I think that's very important to mention. Okay. I certainly would not be panicking about this in the UK.
Is there a vaccination for it if somebody is traveling near there?
No, there's not.
Yeah. What could someone do if they have to work purposes or whatever?
No, I think that you have to be pragmatic about whether you have to go there or not. I'm not, like I said, I'm not suggesting that people should just turn up to China at the moment. I'm certainly not until that.
What about like a neighbouring country, Pakistan, Bangladesh, India?
I don't think there's any harm in doing that at all. No harm at all. I think there are general principles that you need to apply. Stay away from livestock, wash your hands, take respiratory precautions, those type of things. But don't become paranoid about it, and certainly not in the UK. I mean, now what will happen, I imagine, if this sort of paranoia takes hold, which it seems to be doing slightly, is that if anybody sneezes in your direction, you'll start. Somebody might faint and say, "I've got Wuhan, I'm going to die." That type of ridiculous nonsense. I mean, it's silly. So again, think about everything in perspective, and I think if you manage to think about it in the context of what it really is, you will realize that there is no need to panic. Again, it can be fatal in a group of people, but to think that everybody's going to die from it in the UK is a slightly ludicrous sort of thing to reach to. And
just be sensible, be pragmatic, wash your hands.
Wash your hands.
Stay away.
Good diet, healthy. Cough into your elbow.
Can that be a thing now?
Like, I don't know. I'm not going to start advocating coughing into your elbow.
Speak to Nice, maybe.
Somebody can speak to Nice. I'm going to speak to them about it.
And
you can do your own randomized control trial of coughing into elbows.
I know what that is.
You should know what it is.
I forgot all this stuff, bro. Jazakallah khair for coming.
No, it was my pleasure. I appreciate the opportunity.
Don't want to keep you too long, so you can get back to saving lives and building your bunker.
Yeah. But I believe that this deserves a Hadouken. Yeah. I think so.
Okay, there you go.
Just to make my wife happy.
Hadouken! There you go. That's you against the...
That's me against
the anti-vaxxers. Sorry, I had nothing to do with it. So anyone watching knows me and is anti-vaxxer. I'm still your friend. But yeah, Jazakallah khair for coming along. Jazakallah khair for watching at home. If you liked it, give it a like and a share. Even if you didn't, then tell us in the comments what you didn't like about Dr. Imran Qureshi. He's a nice guy, but maybe your medical knowledge
surpasses mine. I'm sure it does. I'm sure all mothers' medical knowledge surpasses mine. Absolutely.
Remember to subscribe and wherever you get your podcasts, Apple, iTunes, and all that kind of good stuff, and the Google one as well. Also, if you reach the end of this video, let us know in the comments as usual that you're pretty awesome, and we'll put the names of the people who gave us a comment in last week's episode on the screen now. So these people are awesome, mashallah, well done, and see you next week. Jazakumullah khairan. Assalamu alaikum.
Assalamu alaikum.